Hello, could you please introduce yourself?
Yeah, I'm Liane Feldman. I'm chair of the Department of Surgery at McGill University and Surgeon-in-Chief at the McGill University Health Center.
Thank you for accepting our invitation for this interview. As the chair of the SIS department, can you tell us more about the vision you have for the Surgical and Interventional Sciences graduate program in the next 5 years?
So in the last year, we actually redesigned our graduate program. And we've had a graduate program in the Department of Surgery for over 100 years. And it was called experimental surgery. Because 100 years ago, that was what people were doing, was developing new operations. But in modern development of surgery, when we talk about not just surgery, but also interventional medicine in general, or procedural medicine in general, is becoming less invasive, more personalized, using advanced technologies, including robotics and catheter-based and image-based techniques. And this allows us really to offer surgery to more people, more patients, who perhaps in the past weren't eligible for traditional surgery with more invasive and open techniques. We know that with changing demographics of our population, aging population, more and more people need surgery, and the ability to offer surgical procedures for more patients will overall improve the health of populations. We've been on the forefront of developing minimally invasive techniques for the last 3 decades. So traditional laparoscopic techniques, how we evaluate the value of those techniques, and how we train people in using those techniques. So the idea was to develop a larger tent in the Department of Surgery by reimagining the graduate program in surgical and interventional sciences.
Now, would you explain how the department integrates interdisciplinary approaches in its curriculum and research to enhance the educational experience for students?
Yeah, I mean, interdisciplinary approaches are critical. We're bringing clinicians and researchers and engineers and innovators and business development people together to innovate, to invent, to identify needs that are really clinical needs or systems needs by being in the hospital, and working with clinicians and clinical trainees to identify what the problems are, but then bringing in researchers, scientists, engineers that have their expertise, and by bringing these together to develop innovative and new approaches to that will really have an impact on patients.
What are the biggest challenges you see students facing in maintaining high standards of education and research, and how does the program address them?
I mean, some of the classic challenges in research are finding the right supervisor when you're a trainee, making sure you're supported in terms of, sometimes that's financial resources, but it's also being in a lab where there is the equipment that you need, having access to being able to develop innovative collaborations. So, I mean, being at McGill University, obviously that's a world-class international university with many, many opportunities for collaboration. Within the department, being a clinical department, having access to patients. So we want to have really research and invention and innovation that's going to have an impact. Being able, as a large department, to support excellence, to support excellent students, to be able to bring people in from around the world, such an international community and department, and be able to link them, incoming students, with the right supervisor so that they can obviously achieve their goals, and have that mentorship that's so important in developing one's career.
How does the department engage with the broader medical and academic communities to stay at the forefront of surgical and interventional sciences?
Yeah, so being a clinical department is a great opportunity to participate in research and innovation and invention that will have an impact on patient care. So I think our focus is really on developing solutions for clinical and systems problems that we identify from working in hospitals and in complex systems. So whether that's a new approach to applying algorithms or math or AI to systems problems that we have, waitlist management, we hear about that all the time. Can we develop digital techniques to improve those? How can we better support patients going through surgery and recovery using digital techniques, integrating all the complex steps that go into recovering from surgery? So I think the opportunities of being in the clinical environment, understanding what the clinical problems are, and then finding the right people to address those gives us, I think, an advantage by having a very this kind of interdisciplinary approach in the department.
And finally, would you comment on why students interested in improving the future of patients should join our SIS program?
I mean, I think this is obviously the strongest department in the Faculty of Medicine at McGill University. I think our vision is to develop surgical and interventional sciences into a leading program, specifically focused in minimally invasive techniques and procedures to really impact surgical care internationally around the world. I think students should join us because of our commitment to excellence and innovation. Of course, the most important thing is our people. I think we have amazing people, surgeons, trainees, of course, scientists, researchers, innovators, and students. And so joining our department is joining our community and joining our family, and being supported to achieve one's personal goals, but also learn from really internationally recognized leaders in surgical and interventional sciences.
And that's a wrap. Thank you for giving us your time.